Hey Dan, I need some help with something.
Yeah, yeah. What's up, man?
Hey, listen, there's this big debate on Indigenous Twitter, and I've got to warn you, it's very controversial. In fact, actually,
Mhm.
you know what? On second thought, I'm just going to keep you out of it.
No, no, no. Come on, man. You can trust me. I got this.
Oh, all right, okay. Here we go. What do you think of raisins?
Raisins.
Yeah, raisins. Okay, so the big debate, like going on for years now, is should food have raisins in them? Like pies, oatmeal, butter tarts, bread. It's split right down the middle, with one side vociferously saying, okay, get rid of them, take them out, put them way off to the side, never to be seen from again. And the other side is fighting for their very survival, fighting tooth and nail for their little relatives' traditional homelands, battling every inch of territory for their very purpose as little shriveled fruit, just living its life before these forces arrive to displace them and disrespect the incredible, sweet, and kind gifts they have to give.
Oh, well, Niigaan.
Uh, I would dare say this war is for the very purpose of raisins themselves.
Hey, man, I don't really think this is about raisins.
I call them little elders, little shriveled elders of the fruit world. Why can't we just respect the elders? I tweet that out all the time, but the war continues.
I think you're right. I am going to stay out of this one.
The Winnipeg Free Press proudly presents, in partnership with CJNU 93.7 FM, Niigaan and the Lone Ranger. Here are your hosts, Niigaan Sinclair and Dan the Lone Ranger Lett.
Welcome, everybody. It's another episode of Niigaan and the Lone Ranger, and we're happy to be back. Some of our loyal listeners, and we do have loyal listeners.
We do have loyal listeners. I'm
Yeah.
actually very impressed, and thanks everybody for continuing to be loyal.
So you may have noticed that we have been somewhat irregular. Let me rephrase that. The timing of the podcast has been somewhat irregular in the last
Well, and
little
also
while,
irregular in other ways, but we'll
in
leave
other
that
ways too. There's been a very good reason for that, and it's and for those of you regular readers of the Winnipeg Free Press, you may have read something about this, but Niigaan and his father, the eminent senator, judge, and
crankier guy
well,
who's
yeah,
getting older and
yeah, I was going to do more lauding of your dad before you got to cranky, but lead commissioner of the inquiry into residential schools. I mean, one of the great men of our time. I can say that. I know you have trouble because he's
Oh
cranky
no,
with you. Yeah,
I say all the great things about my dad, but of
good.
course, I say cranky, of course, because he's had a lot of health issues and it's been a very frustrating ride through the healthcare system, but a really good reminder to, I think, my family in particular, and particularly because I wrote about it, the that we all are experiencing this together in an atrociously bad time in our lives, as the way in which healthcare has been just so flagrantly mismanaged by those who are in the decision making abilities. And I think, those in the frontline healthcare positions get into healthcare because they care about people. And that's still the same.
Mm.
I met remarkable, amazing nurses and doctors and healthcare aides and, even custodians who just remarkable people who are fighting such an uphill battle, but are set up to lose in so
Mhm.
many ways because of the if you read my column, you saw that almost 20 hours with a father in heart failure in an emergency room, just begging for a cot and then later pillows. They have no pillows in the emergency
Mhm.
room, which is just absolutely what a situation that we are in. And Manitoba is no different than elsewhere.
Yeah, when obviously we were talking about this before you published your column, and I remember the text you were sending me from the emergency room at St. Boniface when your dad was sort of in his most perilous condition. And we should say the eminent Maurice Sinclair has come through his recent.
Yeah, he's home now and
Yeah.
he's recovering. Unfortunately, we've got when people age, you've got some decisions to make that are risky, and so those will be coming up. And but at the same time, Dad's doing well and he's recovering and he's taking care of himself. And when you're in heart failure, you every day is kind of precious, and every day you have to really take seriously the signs. And that's the reality of it.
So what as I'm reading these texts, I'm talking to my wife, and like the one that like established, like the word that came to mind was frailty. The frailty right now of the healthcare system was, you're in the ER and your dad's having heart problems and they ran out of heart monitors. And
they absolutely.
I've related that story to people, and that's the gobsmack moment, right? Like this idea that we have never contemplated that we could go to hospital and a basic piece of diagnostic equipment would not be available to us. I mean, like I said, that was the gobsmack moment for us.
And yeah, the really upsetting thing to me, and those who read the column saw that, but because you have to. It's basically every person for themselves in an ER at this stage. And I don't remember it always being this way. I remember it being in which you saw a pretty logical progression or an understanding of what was happening. But one of the most things that I didn't write about was how patients began advocating for other patients. And my family, because we had my sister and myself with my father in the emergency room, we began to advocate for others who were suffering and had no family members with them. And so you really have to fight for those things. And what we started to notice was there was a stream of people who were coming and jumping the queue. And those were mostly individuals with police officers and paramedics and so on. And then some people in very genuine looking emergencies. And but when you're in heart failure, it seems like that should be something that should give you priority. And as you saw if you read the column, I even started to use my dad's sort of well-knownness in that saying, he did an inquest on cardiac investigations previously in Manitoba, and you shouldn't be waiting 18 hours, or in that case, it was around 9 or 10, to see somebody when you're in cardiac failure, when you're in a serious situation. And what happened is the problems were getting exponentially worse. We went from having one problem to having 5 serious problems. And so the most upsetting thing was, I said, why is this not a priority? And they said, it's not an issue of priority. It's an issue we have no heart monitor machines, which means that you're starting to choose who will live and who will die. And putting these healthcare people, nurses, in the case of this, a nurse, all I received back was, well, you can call this complaint line. And it for a family member, I can only imagine how heartbreaking that is. And then the other parts of my experience in the healthcare system was the number of verified sources in it. And I don't want to name who they are, but the number of verified sources, people who are legitimate power positions within a major hospital in an urban center, saying, why didn't they recognize who this person is and just steamroll them through, which I think is the exact problem in the first place.
Yeah.
That I've been told about, and we are pursuing this. The idea that there is a sort of unwritten rule around VIPs within the healthcare system that gets shepherded through while the public gets put in very long lines and hours of waiting time. And I think that's atrocious. But at the same time, I can certainly imagine that athletes, politicians, certain business leaders don't wait the kind of time that we did.
I think there's going to be a lot of opportunities for journalists to analyze what's happening to the healthcare system right now in a snapshot, right? Like there's some things we have to keep in consideration. So governments across the country have decided to abandon all COVID restrictions and, decided that we'd lived long enough with them. So what we've done is we've entered the perpetual flu season. So prior to this, all the people I know and I know, like you, I know a lot of people very high up in the healthcare system, they would sort of say, the biggest challenge they had every year was managing this huge influx of patients during flu season. And the argument was like, there's going to be longer waits, there's going to be hallway medicine during the flu months because we can't build a system that can operate at that capacity year round. We don't need to build a system because, eventually the flu season will pass. Well, we're now in perpetual flu season. And that means that we're operating at the highest possible level of capacity all the time. And that in and of itself is going to cause some of the problems that you experience. The other part of it, though, is that, and Manitoba is not alone, but we certainly lead the country in. The current government decided to prioritize deficit reduction and tax cuts above healthcare, and
issue checks to Manitobans instead of dealing with it, which is a crisis.
Yeah, and
they announced another round.
It's always going to be a calculated risk. Like if you try to hold healthcare funding below the levels of the rates of inflation and population growth, you're rolling the dice, or you're spinning the chamber on the gun. There's no doubt about it. And for this government, the dies came up snake eyes, right? Like COVID. And I think the problem is, my greatest concern is, I don't actually think that anybody knows how to get out of this now, because like we have governments of all stripes who just refuse to do anything to limit our exposure to other people, to possibly slow this perpetual flu season scenario. And and I'm not like, don't get me wrong, like I don't want to limit family gatherings. I don't want to shut businesses down. Like I think it's not all or nothing. But I do wonder why, like, do we really have a good argument for not making people wear masks when they're indoor, with large numbers of people? Like, yeah, like that may be something we have to live with for a really long time, but why aren't we doing it? We don't have a healthcare system that can, that can keep up with the number of people who are getting sick. No one is ever going to be able to build a system that can keep up with the number of people who are sick right now.
We may not have an answer for getting out of the mess currently, but I can tell you what is not going to fix anything. In fact, it's going to make it way worse, and has made it way worse, is the continual closure and therefore funneling of emergency cases, the closure of emergency rooms, which drives people to, a couple different centers throughout the city. And then the streamlining and specialization of those health centers has been an absolute nightmare. And this is from the voices of healthcare providers themselves, which is now, as a example for a cardiac issue. If you have a cardiac issue, you can go to an ER, but you'll only be temporarily taken care of, because the goal is for you to be sent to St. Boniface. And that means that there is an incredible glut at St. Boniface on top of the cuts and scrapes and bruises that people go to for the ER generally. And so what you've got is this massive amount of cardiac beginning cases, people who begin to go into heart failure, for example, who have very small issues. But then they're put in the same queue with those who have the already, everyday emergency situations, which are legitimate, of course. But then what happens is that the very basic beginnings of heart failure are not picked up. The waiting staff, or the healthcare staff, is incredibly overwhelmed, and then exponential problems occur in patients as a result. And then you get into emergency. One of my friends said to me on the phone, get your dad to fake a heart attack, and then they'll take it seriously. And how sad to say that is the only method that you can use to be able to get attention, so that people will care. And I also discovered, probably very upsettingly, that all of the things that were recommended in the Brian Sinclair inquest, which is checking on people in an emergency room when they're sitting there for longer than 15, 16, 20 hours, is unfortunately not being implemented at St. Boniface. It's very sporadic. Over the span of 12 hours, we were checked on 5 or 6 times. And for many people who are sleeping in that emergency room, in some cases, people who are very clearly in dire distress, I wonder if that's a recipe for disaster for that emergency room.
Yeah, and quick recap, Brian Sinclair was a homeless man who presented at HSC, was
Yeah, he wasn't
misdiagnosed.
homeless per
Yeah,
se, but he was
yeah,
definitely in medical distress, and
yeah.
he waited 20 something hours. In which he eventually passed away, had been passed by by dozens of people in the healthcare
Hmm.
field, and people just generally didn't think of him as a human being. They just walked right by him, and
Yeah,
nobody checked on him until finally he passed away as a result of an infection. And
yeah, yeah.
terrible situation, but it implemented changes in the healthcare system. And one of the most important changes is checking on people every
Hmm.
half hour to an hour. Someone with a clipboard coming around checking if you're okay, if you need food, if you need water, if you need just basic medicine like aspirin kind of thing. We did have a few times checked, but it's very upsetting and I don't blame that on healthcare people. Let me be clear.
No, there's not enough
I
of them
blame
right
that
now.
on the
Yeah.
fact that they are absolutely avalanched with cardiac cases and then basic emergency cases because the province has decided that they are the specialized unit for cardiac cases, and then on top of that they got to deal with all the other work. So now they're doing 2, 3, 4 times the work they did before with less money.
So, there's, I mean, upcoming very soon, there's going to be a meeting of first ministers, health ministers, and the prime minister to discuss a new healthcare deal. And, I'm going to be an optimist, but my great hope is that that this gathering of political leaders, that there's some humility in the room, there's some admission that on a provincial basis, most provinces are failing at the delivery of healthcare right now. If there's going to be more money, there has to be a radical shift. At the same time, right now we're talking about national standards for long-term care, and the fact that the federal government is refusing to legislate these new standards for long-term care. Long-term care, by the way, which is not a medically insured service. Somehow we forgot to include that when we created the Canada Health Act, and then the ongoing shortage of resources for home care that keep people out of hospitals longer. I think I think unless they're bold and humble and willing to really do things differently, I think we're here in perpetual flu season. We are as screwed as screwed could be. Sorry.
Yeah, and it is absolutely atrocious and somewhat shocking or brain numbing to see provinces that are issuing checks to individuals when their healthcare system is just so failing and in dire situations that are creating actual harm of real life people. I just can't fathom this idea. And our colleague Tom Broadbeck wrote a very interesting column about sometimes I'm always kind of I'm always very encouraged, I think, because at the Free Press we have this kind of set of people throughout the paper that are really engaged in thinking about where Indigenous people in all of this. And I think that his piece was very intriguing in saying, like, why are healthcare, in the pandemic, perhaps there was no more efficiency or dealing with the issue of COVID-19 more directly than on First Nations. And so perhaps we could learn a lot from First Nations too. And there's that humility that you were talking about.
Yeah.
The reality is that provinces need to realize that there is no I in team. And perhaps they might want to be thinking a lot just about their electorate. They might want to also be thinking about what it looks like when they issue checks and their healthcare system is failing. And then also, what does it look like in the province beside them in the so-called confederation to be able to deal with this thing on a national basis?
Mm-hmm.
And I don't think being afraid of standards or being afraid of what is often called strings attached from the federal government. We should be thinking about people here. And
Yeah.
ultimately, I'm not saying the federal government's any better. I'm just saying that the federal government, by asking the provinces to deal with the issue of the emergency of healthcare, because they're hearing about the emergencies too.
So today we are well, first of all, we're going to pass on best wishes to your dad. Fight the good fight, man. And
yeah, no, he's recovering.
So we have a very, very, very special storyteller segment today. I don't want to give away anything about the person who's doing storyteller today, but it's like a real coup that we got this person. Well, you know who I'm talking about, so just be quiet. And and then we're also blessed. We have a longer interview with Angela Mathieson, who is the outgoing president CEO of CentreVenture, which is the city's principal downtown development corporation. She's got some strong observations on a career, 25 years working for various agencies and government departments trying to develop downtown. Got some great thoughts about the work that she's done. And let's move on now to the storytellers. Hi, my name is Dan Lett, and this is The Storytellers. This is my story about a brief but very memorable meeting with Cuban President Fidel Castro. It was January 1997, and I was serving as the Free Press national correspondent in Ottawa. I suddenly got an opportunity to follow Liberal MP and then Foreign Affairs Minister Lloyd Axworthy on a trip to Cuba. It was a historic visit for a number of reasons. Axworthy was to be the senior-most Canadian politician to visit Cuba since former Prime Minister Pierre Trudeau's infamous 1976 trip. But it also came during the height of economic sanctions against Cuba by the United States, in defiance of U.S. laws threatening to punish and even jail Canadians from doing business in Cuba. Axworthy jetted off to Havana to meet directly with Castro. Working as a foreign journalist in Cuba was quite an adventure. We had to get a visa, we had to register with a press office in Havana, and then government officials insisted on providing chaperones and all transportation to and from events involving Axworthy and Castro. That turned out to be a catastrophe. On the morning of the first official day of events, we boarded white cargo vans provided by the press office. We were told we'd be joining Castro and Axworthy at an official tour of one of Cuba's natural gas fields. At the time, Canada had a huge interest in selling machinery and technology to Cuba's growing oil and gas industry. We did arrive an hour later at a gas field, as promised. The stench from the flare was overpowering. It made for great images for my television colleagues, but there were only two problems. No Axworthy and no Castro. Turns out they had gone to a different facility. The press office later claimed, rather unconvincingly, that there had been an inadvertent crossing of wires. That might have been a plausible explanation, except that it happened the very next day as well. Meanwhile, Cuban television had all the money shots of Castro and Axworthy on their evening broadcasts. Beyond angry, 3 journalists from the Canadian media contingent, myself, and representatives of both CTV and CBC, went unannounced to the Canadian embassy and insisted on meeting with Ambassador Mark Entwistle. The ambassador offered us his apologies for all the dirty tricks. He then made a most extraordinary offer. If we were to stake out his official residence the following day at 11 a.m., we would get to see Castro arriving for a one-on-one lunch with Axworthy. He also told us candidly that Castro absolutely loved Okanagan Valley wine, and that quite a bit of it would be served during lunch. Following the meal, if we were not too pushy, the ambassador was quite confident Castro would entertain some questions. Not sure if it was all going to go down as Entwistle had described, we nonetheless gathered under a glorious palm tree outside his official residence the next morning. And then, just before noon, an exquisite, gleaming black vintage Mercedes limo pulled up, and out popped Fidel Castro. It was like seeing a movie star up close. He was resplendent in his trademark olive-colored fatigues and cadet cap. He was tall, very tall, and athletic-looking. He looked at us briefly and then dashed inside the residence. 90 minutes later, the ambassador's wife came out and gave us the 5-minute warning to take up our positions. When Castro emerged from the residence, he did appear, for lack of a better term, well lubricated. And then, rather than ducking back inside the limo, he paused, stared at the throng of journalists, and almost dared one of us to ask him a question. That one of us turned out to be the correspondent for the New York Times, who asked him a barrage of questions in Spanish. Castro thundered his responses, also in Spanish. He railed against the Helms-Burton Act, which punished anyone from doing business with Cuba. He referenced the Magna Carta for reasons that still escape me, and then he blamed the United States for a whole host of social and economic woes. Castro signaled the end of the interview with a sudden and somewhat angry wave of his hand. The whole time I had been standing directly across from him on the driver's side of the limo. And before he ducked back inside, he looked directly at me, smiled ever so slightly, and nodded. He sounded quite like a drunken madman, but his nod convinced me this was something else entirely. He wasn't the rambling, drunken fool. He was merely reprising a role that he had honed for many, many years. The role that he used to taunt the United States and keep the Americans on their toes. Or at least, that's what I thought at the time. This week's episode, we're very happy to have Angela Mathieson, who is the president and CEO of CentreVenture Corporation, which is the principal downtown development agency for the city of Winnipeg. It's been around for more than 2 decades. Angela has been with them, with CentreVenture for about a third of its lifespan, last 8 years, and she's just stepping down. And it's a good time to kind of reflect, I think, on the state of downtown. It's been a major concern for the Winnipeg Free Press. We just published a big, fat, hairy series on the state of downtown and the future of downtown. So, anytime in journalism, anytime you get to speak to somebody when they're on their way out of a job, that's a time that, to eat well on inside information. So we're going to get Angela is going to give us all the inside scoops on what's happened over the next decade. She's looking at me on Zoom right now thinking, oh my God, what did I get myself into? Is that
got it? This is my exit interview, I guess.
your exit interview. And I can't say for sure, but there could be up to 2,000 Winnipeggers who are listening to you review your own performance over the last 8 years. But I should say as well, how do you feel about leaving CentreVenture? Because it is a bit of an all-consuming job, is it not?
Oh, it is, for sure. Many nights thinking of new ideas when I probably should be getting a better rest. I've been with the organization for 8 years, so, I think that's, enough time to achieve a pretty good roster of accomplishments. But, to go forward, you got to have the energy to look ahead and be the one to implement what's going to happen next. And maybe I don't have that. So it's time to try something new.
Although, as we discussed it, you're not completely leaving the world of urban planning and development. Like this is, you want to continue to pursue this as a sort of as a life passion now.
It has been my life passion for 25 years, yeah. And most especially the downtown. I've had the great honor of being involved in this genre of work now for 25 years. So I think I've learned a bit about what's worked, what's not worked, and to the best of my ability, I'm going to keep giving people my advice. I probably will, whether they like it or not.
Yeah, no, I think you'd mentioned to me that you had a rather circuitous route into the world of like urban planning and development. Like that it wasn't, you didn't as a 11 or 12-year-old girl in school, you didn't dream of a day when you could broker multi-million-dollar deals for, retrofitted department stores. When you headed off into pursuing professional things, what did you first pursue?
Well, when I was a kid, I was always involved in the arts, and I did think that that was going to be the route that I took. I was very involved as a kid in the visual arts, and I don't remember, at one point in time, I ended up getting involved in theater. And as a kid, I would take the bus downtown. I get off at Main Street right across from City Hall and walk up to what today is the Red River College Princess Street campus, was Prairie Theatre Exchange.
Right.
And climbed up these old rickety stairs, this old building that was probably pretty close to falling down at the time, and took theater drama classes there for many, many years. It did two things. It certainly solidified my love of the downtown as a young person and how unique and different it was than sort of the street I grew up on. But yeah, it got me interested in creative pursuits for sure. So that sort of morphed, and I thought I was going to go into stage design at one time. And I had a friend who said, well, if you're going to do that, you should go into interior design at the U of M, because there wasn't really a class or a program for set design. I did that for a while, and then I started meeting all these architects and city planners, and then all of a sudden, and actually we ended up doing a studio, an interdisciplinary studio of all of those folks downtown again on Albert Street in the building that I think had Mondragon one point in time.
That's right, Mondragon.
And we were studying how to revitalize the Exchange District. And it seemed to me that the city planners were sort of leading the way in this studio. And I thought, well, maybe that's what I want to do.
Mm-hmm.
And that's what I ended up doing. And then I ended up graduating. I worked with a consulting firm of a really, really wonderful man, Jim August, rest his soul. Him and I I was his helper, I guess, for many years in his consulting firm. And then got working in government, and then that sort of started morphing into more economic development, but still always with a city planning bent. And I kept going, and I don't know, I didn't do a lot of job interviews. It just sort of was one thing after another, and that's what I tell young people too, is you get an opportunity, take it.
Yeah.
Then I was Assistant Deputy Minister for Urban Affairs for many years. And then I became a Secretary to Cabinet to Gary Dewar for Community and Economic Development.
Yeah.
And there I did everything from hog plants to hydro dams, but I still love the downtown, and spent way too much time on that probably than really was in my job description, and knew that I had to keep working in that area. So when I left government and the opportunity, CentreVenture came up, I grabbed it.
So you mentioned Jim August, and that's really like kind of opened a bit of a floodgate of memories for me. Many people listening are going to know who Jim August is, because it's just an iconic figure in the redevelopment of downtown. When I first came to Winnipeg, and I'm not going to say the year, because I now work with people at the Free Press who weren't born yet when I started at the Free Press.
I know how old you are, Dan.
Well, okay, so that we're everybody, like, there's certain things neither one of us are going to talk about today then. But when I first started in the late 80s, one of the first people I sort of connected with was Jim August, Core Area Initiative, which was, maybe the first iteration of a 3-level tripartite funding to do things at in the downtown Winnipeg, and then the Forks Renewal Corporation. He was heavily involved in that. And really, Jim was the guy who helped me kind of understand what the hell Winnipeg was all about.
Yeah.
And, because I'm, transplanted Torontonian. I'd been working in Alberta, came here, and it was kind of like, oh my God, like there's so much cool stuff going on downtown, and yet there's such what's the right word? Such a self-loathing about downtown as well. I don't think that's an understatement. Jim helped me understand people don't really hate downtown. They hate themselves for hating downtown. This is going to turn into a John K. Samson reference soon, right? Yeah, he doesn't really hate Winnipeg.
Yeah.
That's right. He doesn't really hate Winnipeg. But for following in the footsteps of guys like Jim August, what did you learn from him that you were able to apply later on in the work you were doing?
I learned something pretty basic from him, which is to have a can-do attitude. And I was lucky to work very, after with folks like Eugene Costera and Gary Dewar and these were folks who had a can-do attitude. And I always say, and over the years, I've had staff who, sometimes get down on themselves, and I say, please, just whatever you do is start the day with the word yes. You might work your way to the end of the day to no, and that's okay, because sometimes you can't do things. But always start from the word yes. And it's a philosophy that I've carried forward, is whenever somebody has an idea and comes into our office here, my first inclination, or my first thought, is always, how can I help this person achieve that? And I think, and it's sort of a bit of a privilege to actually be in that position. I realize that. And folks like Jim had that, right? Like working with the Core Area Initiative. I mean, we had never seen that, and I don't think Canada, actually, if you really look across the country, never seen that kind of collaboration between the three levels of government towards one goal,
Yeah.
which was to see not only the downtown, but the whole core area, inner city of the city of Winnipeg, reach its full potential and to become really a healthy place to live, work, and play. And, so he worked in that and he saw that. And so he never stopped having that attitude, like, we can do stuff, we can have good things. And I learned that from him. And I think that that's helped, because where there people may perceive barriers, I always think, oh no, there's a way to deke around that. There's a way of getting to find other partners to help you do it. Right?
Yeah. I'm not, I wasn't using the wrong word when I talked about how Winnipeggers love to hate downtown and then kind of hate themselves for hating downtown. Like it's this, kind of vicious cycle of talking down the downtown, and then, wishing better things for it, but, not really being sure what to do. I mean, is there something about the Winnipeg culture, the Winnipeg mindset that kind of puts us in this gerbil wheel of, self-loathing and indecision about what to do about downtown?
I mean, I think we always say this is Winnipeg's always like a few steps behind everybody else. And I don't know exactly why that is. People talk about us being out in these barren
Oh, sorry. Hang on just a sec, Angela.
and so far away.
Yeah.
I think that's, you can say that more.
Sorry, just hang on a sec. Well, we're going to go back because you're pixelating. Your audio is pixelating on me. I might, if it happens again, I might get you to turn off your camera. But so I'll just go back to the question. So, like, again, my view is sort of still a bit of an outsider. The impressions that were made when I first got here. This idea that so many Winnipeggers hate downtown. And then when you press them a little bit on it, they kind of hate the fact that they hate downtown. It's kind of this weird gerbil wheel of self-loathing, where they don't like downtown. They don't want to go downtown. They want downtown to be better. They do. They support the aspirations, but they really, in the end, I'm not sure they do enough to support downtown. What is it about the Winnipeg culture, mindset, or whatever that kind of contributes to this?
I mean, I think to some extent it's maybe some of our leadership being a little bit behind where the populace is in terms of their desires and their wants, right? Like, very recently we polled people and 70% of Winnipeggers were worried about the downtown, and about the same amount of people wanted governments to do something about it. I actually think that's a much higher number than, say, you would have had even, say 15 years ago. So people's consciousness, why? Because they're traveling places. They're even traveling in Canada and seeing cities, doing active transportation, doing public art, doing, these amazing and unique places where you can take your family in the central cities. And so I think, they're yearning for it. I think they're frustrated that it isn't being prioritized. And so they want it, but they don't know how to get it, and that's natural. I mean, it really should be our leadership and our senior management of our various organizations, figuring that out. But it's not happening fast enough. I think that's what it is. I think they're seeing in other places it's not happening fast enough, and they're getting frustrated. Yeah.
I remember one of the best conversations I ever had with Jim August. This is turning into the Jim August tribute podcast.
I'm totally okay with that.
No, so am I.
Yeah.
But I remember saying to him, like Winnipeg started the beginning of the 20th century. Chicago of the North had the tallest building in Western Canada, and then all of a sudden, like when I arrived in Winnipeg, like the skyline was really underwhelming. And I remember asking him, like, isn't there an ambition and the capital to build taller buildings in Winnipeg? Like, because usually that is kind of a statement of a city's ambition when they build tall buildings. And I remember very distinctly Jim saying to me, like, as I said, what is it? Like, could it be the geology, the water table, what is it? And he said, no. He said, A lot of people in Winnipeg, they just don't want to be that high off the ground. Like they like the idea of a good view, but they don't want to be too high. And it's funny because that is a comment that really kind of describes the very modest approach, like the very restrained approach that we've used to developing downtown. Now, we don't have the private capital that some other cities have, but even so, like this is not a city, like the people who run the province and the city, regardless of political stripe, they have not wanted to move too fast or too high or too big. Is that a fair comment?
Oh, I think so. And I think like my best advice right now to folks in those positions of power is, I think probably now we have to lean in a lot more and be a lot bolder about how we're approaching building up our central cities for sure. And I think it's two parts. It's investing in the downtown for sure. But I'm a city planner, so I'm growing to understand the sort of macroeconomics of it all a lot better. And I sort of equate it to sort of trying to walk up an escalator going down.
Yeah.
If you stop at any point, you're going to get back to the bottom. That's, if you run out of breath, you're going to get back to the bottom. So we really need something that's sustained. And I think the only way to sustain it is to look really closely at how the rest of the city is building. We're building it out. And yeah, like you said, we got to look at ways to start building it up.
Yeah.
Otherwise, we're going to break the bank and we're going to lose this.
So let's do this in two parts. We'll talk about the progress that you and I have seen over the last 25 or 30 years in downtown. We'll talk about the good stuff. And then let's put it into the context of where we could have done more, we could have moved faster, those areas where we need more, as you say, lean in more. So I think I related a story to you that the day I got hired by the Winnipeg Free Press, I went to a phone booth. And, for those listeners who don't know what a phone booth is, they used to put phones on out in boxes on the street and you could put coins in it. And yeah. So anyways, I called my mom to tell her that in Toronto that I'd been hired at the Winnipeg Free Press, and I could barely hear her on the phone because of all the construction going on for Portage Place. So, in my lifetime, I've seen Portage Place, Red River, college campus, all the development from the Pan Am Games, Forks, Arena, all these things. So, like when you look back over that, how would you describe the progress? Like you would say there has been progress. How would you distinguish it?
I think what we learned from projects like North Portage, like Portage Place, was, although we still struggle to really kind of grasp this, is that if you build it, they won't come.
Yeah.
That is what we've learned. We still think that maybe they will if we keep building these projects, that they will come. And so, and we still have these debates about where to put things too. Like I remember with the Red River College, you talk about Red River College on Princess Street. That was one of my first files when I worked in government, and I was terrified because it became such a big public issue about where the Red River College campus was going to go. It was going to go either where I used to take theater lessons,
right,
near the city hall, or it was going to go across on Spence Street from the University of Winnipeg. Big public debate about where this should go and so on. And there was this, well, it'll have more impact if it goes here. It'll have more impact if it goes there. And then we had the same thing with the arena. Should it go where the Eaton's building is? Should it go across from the convention center? We had where's it going to have this biggest impact, right? Like if we build it here, will more of them come here or there? And I think we've learned that those kinds of minor tweaks don't really make a difference. They should be downtown. That's key. And that you have to wrap around it a little bit more, and you have to do more to really capitalize on those investments. So I know when the arena was built, we set up this Portage Avenue Stakeholders Association, which ended up becoming this whole shed district. It was really a marketing idea, right? How do we market this whole thing? And then we said, okay, well, how do we put in place, get some of these properties in and around the arena and the convention center that were derelict? I think of the Metropolitan Theater, for example,
Right.
We were going to have this convention center next to a wholly dilapidated theater. But it wasn't going to just organically happen. It wasn't a game of SimCity, right?
Right.
We had to go in and make some interventions and do things, and the city put in place some better tax systems to support things because they understood that some of the economics were tilted away from these types of developments. So it really required this kind of wraparound idea. And that's what we learned. And so Portage Place, when it was developed, of course, it had a big flurry of activity and everybody was really excited, but it wasn't too long before the south side of Portage Avenue
Right. Yeah.
started to get, started to lose some of its retail occupancy. And of course, finally, sort of the nail in the coffin was the closure of the Eaton's building in 1998. Because the whole mall had been built upon this suburban idea you got in, which we see in the malls today. I mean, maybe they're different retailers today, but you had the Eaton's at one end and you had the Bay at the other, and we built this brand new facility connecting them, and one of those anchors closed.
Yeah.
And so we realized this isn't enough. And I think even when those projects were being done, we knew that housing, most successful downtowns needed housing, more people living there to get that 24-hour eyes on the street, the Jane Jacobs effect, right?
Right.
And so, and in 1999, when Glenn Murray set up CentreVenture, I think there was a clear understanding that the organization was to focus on getting more housing downtown and heritage buildings, because we had so many wonderful heritage buildings. So those were sort of the two primary mandates. And the organization, we provided lending to projects. Like I said, we assembled lands and those kinds of things. And so we started to get it right, that it wasn't like just build a big building.
Yeah.
and to think that there's going to be this massive spin-off effect. It takes a little bit more tender, loving care and addressing some of the more fundamental economic reasons that people aren't investing in the downtown.
So we could fairly categorize the progress that's been made in downtown as positive, but maybe lacking in a little impact and momentum. So we have done sustaining. Yeah, everything that you've mentioned, it's all net positive. There isn't. Sure. But the missing piece of the puzzle, and which I would agree to, is the residential. Now, you recently wrote a piece for the Winnipeg Free Press. God love you for writing for the Winnipeg Free Press. Really appreciate that. And at the time this was just last October, we didn't know that you were getting ready to move on. But when I read this piece now, there is a lot of heartfelt. You very passionately defend the downtown, and at the same time, I get the sense of the, maybe a little profound disappointment about what we haven't accomplished. In particular, so you mentioned the importance of residential, of not relying on, there are no catalyst single one-off developments, and you notice, residential, we've made progress, 45 new homes. 45 new housing units downtown, but over the period of 4,500 over a period of 200 or 2 decades. So we're talking about 225, 250 units a year, and that number really that was a shot to the solar plexus for me. I would have thought it was more more than 4,500. More than 225, units a year, and that's just really not. These are my words, not yours, but I don't think that that's taking the challenge and recognizing the importance of residential to the down. It's just not. It's just not there. We're not getting behind the thing that we know that is going to make the biggest impact.
Oh, for sure. I'm ever optimistic, but I'm also someone who doesn't shy away from speaking truth to power, that's for sure. And, really the last program we had and there's reasons why right now as governments need to provide some degree of tax incentive to encourage residential development. I hate that it's the case, but there is some systemic inequities in the cost of construction downtown compared to elsewhere that will take much bigger shifts to change. And so governments have been saying, if you build a building in the downtown and you're going to raise the taxes on that site, we're going to give them back to you for a couple of years to offset capital costs.
Tax increment financing.
Tax increment financing. Yeah, people do TIF. But really is saying, you do this, we're just going to give it back to you for a little while to help you do that. So the last program we had was in 2014. Last program. Okay. People see lots of buildings going up and get very excited, and some politicians have even cut the ribbons on those buildings. But those buildings were actually, seeded and started more than 8 years ago.
Wow.
So when I talk about that escalator, if you pause for a second, you're going to go back to the bottom. And so we have to figure out a way to sustain that. And it means getting at some of these more fundamental reasons why there is a differential cost in construction downtown. But in the meantime, we should be sustaining these programs. And that didn't happen in the last city council administration.
No.
And only until the pandemic, when we finally convinced them, because we said, not only are we seeing a dramatic reduction in residential construction, you're going to start to see Class C office buildings start to shutter potentially as a result of the pandemic. And then we got them to with some degree of support. But now we're climbing back up that escalator, and
So are we talking about something as simple as political will? I mean,
yes.
Because it certainly seemed that there was a convergence of municipal and provincial government, like the flavor of provincial and municipal government. Neither level of government really, really wanted to prioritize this, and so they didn't. They talked the talk on downtown, but didn't really. So is that an unfair description?
No, it's 100% accurate. No, it is.
So why did downtown as a policy priority, why did it lose its luster?
Oh, I don't know. I actually don't know if I know the answer to that. I mean, it requires. I mean, it requires people to really dig in and understand the reasons why, like what your types of questions that you're asking. Why did we see some success before? Why are we not seeing it now? What's missing? And that requires a certain level of work and sort of, I guess, intellectual energy into it and other priorities, right? Other priorities come up, and there's only so many things that you can handle at one time. I'm feeling more optimistic about the political will, to be honest with you, in the downtown. I think in many ways the pandemic shone a light on the downtown in, unfortunately, a negative way. But it also then, I think, causes people to have a little bit more resolve about it and to say, okay, maybe we should be trying to do something about this now, So, but again, I think it's going to be really hard to make massive strides unless that kind of commitment is sustained. But you know what I think it is? I think that, and I think this will change, because the politics of downtown and how important is downtown to the average voter, right? I would say 15 years ago, and I know for a fact it was pretty low. Very low, and that's changing, and it's changing mostly by young people. Right? Young people are wanting, more walkable types of cities. I was interviewed by another media outlet last week about new projects like around the Pulla Park, right? The Pulla Park, and then building this housing and you renderings that look like they could be the Forks, or they could be, around the arena and Turner Square. And people said, well, do you have a problem with this? Are you concerned about this new housing going out to Pulla Park? And I'm like, no, it's great. It's proving to me that folks in the development industry believe that there is a market for a complete community, a community where you don't have to get in your car every single time you want something,
Yeah.
where you have entertainment that you can walk to in the evening, where you can go and get your groceries without it being a big production, or get one or two things at a time, just to make that your evening outing, right?
Yeah.
That's what we have downtown. And I think, I think that if the market is growing, that's great. We just have to make sure we're getting some of that market share. Yeah.
Yeah, it's the age-old problem, and it's not just a problem in Winnipeg, but I mean, personally, the 70% of people would like to see something happen downtown. I think that the mitigating factor maybe in that result is the fact that what people want to have down, like what people who don't live and work downtown, they want improvements in downtown, but they don't necessarily want the things that the people who live and work downtown want. And we saw that during the Portage and Main plebiscite. The people who really live and work downtown, they really wanted the intersection open. I mean, they didn't just want the intersection open, but they also wanted reimagining of the transit routes, to take some of the traffic away from the intersection. They wanted, some streets in the Exchange District made into pedestrian malls. I mean, it was really connected to a broad myriad of issues. And yet, it was the donut phenomena, like where the suburbs, rose up and like squashed the idea. And that makes me kind of worried that, like, for example, anything that has to do with preferential tax protocols or regimes, like anything that's an incentive to get people to build, but also people to buy and live downtown, is that the way provincial and municipal government is structured, there are very few elected officials that represent that downtown area, and they don't have the political muscle to convince the people who represent other areas of the city to get it done. Is that 70% genuine, like, let's do things for downtown that we maybe aren't doing in other parts of the city?
Oh, there's a lot to unpack in that question. I mean,
It was an awful question. I'm just acknowledging
No,
right
it's
now.
good.
It was brutal. There was good thoughts in it, but it was brutally
No,
posed.
these are the questions. I mean, I could go many ways on this one. I know what you're talking about, and there's a sort of a bit of a parochial. I see it on city council quite a lot. A bit of a parochial attitude when it comes to investments in the downtown. Oh, well, it's like investment in the downtown against my community center, or even arguing for more compact development to somehow going to offend people who live in the suburbs. And I say, you know what? I try to say to suburban councillors, I say, you know what? That your constituents don't want you to keep expanding the city and creating more traffic on the roads that they travel on, more wear and tear on the things that that they enjoy, like their libraries and schools and so on and so forth. They don't actually want that. So there's a really actually pretty strong political argument for continuing to build up in this center of the city. And all suburban councillors, I think, should get on board with that, right? Number one, I can't even get the next clause in your question.
No. Well, but just like
I was rambling, and now I'm rambling. But I want to get back
I know. Like, you have no idea. Like the people I work with they're all smiling and nodding right now, and at the rambling question. No, I think it's the idea of, like, when I think of the lack of political will over the last 8 or 9 years, and compared to this idea that we really need to lean into this. Like, if we're going to really transform downtown, use the tools and apply them to the type of projects, residential, that we know are going to make the biggest impact. And the problem that I have is that I don't believe that the Brian Mays and the Janice Lukes of the world are going to allow that to happen. I don't know what's going to happen in the provincial election. If what happens is what we think is going to happen, there may be an entirely new focus on downtown that the current provincial government just simply does not have. But even then, the real politic of the way the city is structured, I think, comes into play. So, in your optimism, do you see champions that are willing to run the gauntlet of this, you know, this that self-loathing again. Like, oh, I really wish downtown was better, but I don't want them to do anything downtown that they won't do for me out in the suburbs, kind of thing.
Yeah, no, I am optimistic. I am optimistic for the reasons I said before is I think we have a growing cohort demographic that does care about this. And they're not the 50-year-olds, they're not the 60-year-olds, they are the younger folks who want their city to be like the other cities that they spend a lot of money to travel to every year. And so that group is going to keep, going through sort of this demographic swath, and they're gonna have a bigger impact for sure. But I do have optimism. I do have optimism. I think that the mayor who's recently elected, Mayor Gillingham, I do really think he is getting it. I think he's trying to talk to lots of folks and to get a good idea about what to do going forward. You mentioned Janice Lukes. I know she's a suburban councillor, but I also know she's a big supporter of the downtown. So I think there are some champions there. I do think so. I think we need a strong leadership to gel that into, a series of actions. The city's just about to launch this year, I think, by the end of the year, a new downtown plan, which we're having a big input into that I'm hoping will be a little less like the old plans that just go on a shelf, but a plan that has some concrete actions and some resources around it, because that's really the best we can do. Is we have to get enough people around the table who want to see good things happen, and you just keep pushing on. Yeah.
Well, I love the Winnipeg downtown. Some of my family works downtown here. We go downtown all the time willingly. And, we really want to see more done there. So I share your optimism, tinged with maybe a bit more, cynicism than you're expressing, but we need real optimists to kind of drive this forward. So I just want to thank you for kind of, joining us today and having this conversation, because it's important. Like it is, in the end, solving downtown is fixing Winnipeg too. It's not just downtown. So
for sure, it means something. It matters to everybody.
And we're back, and there's been lots of changes in Manitoba over the past week or so, while we've been thinking about healthcare and talking about downtown and the library, and there was a cabinet shuffle. And cabinet shuffles, sometimes they create a big splash, sometimes they don't. This one is very much about the new upcoming provincial election that's coming in October for Manitoba. We have 4 new cabinet ministers, some absolute newcomers who have just literally just been in government for a few minutes and then are immediately into cabinet posts. Janice Morley-Lecomte is the new Minister of Mental Health and Community Wellness. James Tietzma, well-known advocate, conservative MLA, new Minister of Consumer Protection and Government Services, and then 2 newcomers. Abhi Khan, former Winnipeg Blue Bomber, who's been much heralded in Fort White, is the new minister responsible for sport, culture, and heritage, perhaps unsurprising. But then perhaps the most surprising post, Kevin Klein from Kirkfield Park, who literally was just voted in a couple weeks ago, is the new Minister of Environment and Climate and Minister responsible for Efficiency Manitoba. There's some surprising appointments here.
Yeah, I mean, I think for a little context, so the Premier is drawing from a smaller gene pool for this cabinet shuffle. So 10 MLAs had announced re-election. Well, actually 11. MLAs had announced that they were not going to stand for re-election, and that that takes out a third, basically, of their caucus. So, and a lot of the people retiring from politics, we assume, are they're experienced people. They've got tons of experience, people that the Premier could rely upon to. Because, like a cabinet minister's first role is to not do anything stupid and embarrass the Premier. So, these people were all mostly safe from themselves, not entirely. The real wild card came when Finance Minister Cam Friesen who had previously told the premier he was going to run for election, suddenly, and this is just a few days before the cabinet shuffle, announced that, he's not going to run for re-election. He is going to try and get the federal nomination in Portage Lisgar. And I think there's a lot of backstory to the Friesen thing, which we can discuss in a moment. It forced Premier Stephenson do a couple of things. One is she had to call upon two MLAs who are not running for re-election and had to keep them in cabinet and key posts. One was Cliff Cullen, deputy premier, and he also becomes the finance minister. And Eileen Clark, who steps back in, is Indigenous reconciliation and Northern Affairs. And Eileen Clark is an interesting story because not only is she actually probably the you'll tell me if I'm wrong, of course. Number one choice, yeah.
When she left the post, of course, highly controversial reasons she left, but very few conservative MLAs have I heard in the history of Manitoba politics are as beloved as Eileen Clark. I mean, there's much to say about the Pallister government, later the Stephenson government, when it comes to Indigenous relations, whether they're failing, succeeding, whatever. But I will tell you that Eileen Clark is pretty universally loved, is on speed dial with most of the chiefs of the major organizations and David Chartrand, like literally very close relationships. And people were very disappointed when she left for quite controversial reasons. Of course, she left because of the comments that Brian Pallister made involving colonization, which were just ahistorical and incorrect. And I came out and you wrote about this as well, and she led I wouldn't say she led the revolt, but she certainly was the tipping point, I think, in the Conservative caucus, which led to Brian Pallister's resignation.
Yeah, basically, there were two bombs dropped. One was, settlers didn't intend on committing genocide, comment by Brian Pallister. And I just promised to myself that I would never talk about that woeful moment ever again, but it's important context now. And then Alan Lajmodier and his attempts to rationalize the toxic effect and impact of residential schools. And Eileen Clark, who had built enormous credibility with Indigenous people, literally just said enough is enough. And she resigned and told the premier she couldn't represent a government that would say such horrible things. Indigenous leadership, and this is the first time I've ever seen this happen, came out and actually criticized the premier, not just for what he said, but for losing Eileen Clark. And so those incidents did create it absolutely, and I wrote about it at the time, created the critical mass within the Progressive Conservative Party and government to oust Brian Pallister. So he was given an ultimatum 2 years ago, leading up to a big caucus meeting in Brandon. If you don't resign now, we're going to publish an open letter signed by several hundred, that might be an exaggeration, but opinion leaders within the party asking for you to resign. So if you want that to be your legacy, then hang around. And so, yeah, I think you can say Eileen Clark really got rid of Brian Pallister.
Cabinet shuffle is all about trying to put a fresh coat of paint on a government that maybe is looking older or looking cracked or looking, a cabinet shuffle is almost always about either crisis or it's about renewal in some way. And certainly there's a lot of criticism coming from the NDP saying, pointing these brand new people who just won by-elections weeks ago, months ago, whatever, getting major roles within the government is an indication of what the NDP is calling chaos. I mean, that'll show whether it is. I mean, certainly ministers that are in for only a few months certainly can't do any changes or major. I mean, this is really a cabinet that's going into an election, hopefully a cabinet that won't step in any messes between now and October. But particularly the big question to ask is, can the Conservatives gain back Winnipeg? Mm-hmm. They are polling, below 20%. Can you make an inroads in Winnipeg? Kevin Klein, who's now been, we mentioned before, only in the legislature for a couple of weeks, now suddenly is the minister. I mean, he was in a very close by-election fight, which really shouldn't have been close. Was a traditionally held, very strong conservative stronghold, and only won by a few hundred votes. And here we are looking at the Conservatives trying to make inroads back in Winnipeg, trying to gain some kind of support. I don't know. Can they do it, do you think?
Well, I mean, like I get asked all the time, like, is the NDP going to win the election or the Tories going to hang on? I mean, I think all options are on the table right now. The Tories, the big card the Tories have to play is that they have a budget. And the budget will be an opportunity for them to start a new narrative thread for their government. Now, what's interesting is, and this relates directly to the cabinet shuffle, this was the subject of my column on the cabinet shuffle. If you want to take a glass half full view of what Heather Stephenson did, she seized upon the opportunity to replace Cam Friesen after he made his announcement. And it became very clear leading up to the cabinet shuffle that there was an enormous rift between the premier and her finance minister. That's an important relationship in government. The finance minister traditionally is the cabinet minister who's supposed to be able to say no to the premier. There's supposed to be some pushback. In this particular instance, though, Cam Friesen, according to my sources, had become an obstacle to what the premier wanted to do. So she wanted to maybe do some different things. And Cam Friesen basically said, no, he controls the purse strings. He controls Treasury Board. Treasury Board has to approve any new expenditures. It is telling that the week before the cabinet shuffle, the premier played a very big card within the announcement of a special warrant, new spending, $850 million on a whole range of things, infrastructure. It includes this most recent $200 million carbon tax buffering check bullshit. Sorry, did I say that? Adam, don't edit that out, okay? But really, like the worst possible form of a use of tax dollars at this time. But what's important is she did that announcement, $850 million. Cam Friesen was not in attendance for that announcement. And the reason is, she knew she was getting rid of him at that point. And, honestly, I'm not sure what she's going to do with this newfound freedom she has. But Cam Friesen most definitely was delaying the implementation of the $200 million healthcare resource plan, incentives and recruitment things to get more doctors and nurses in Manitoba. They've made no progress to date. And a lot of that, my sources tell me, is because Friesen was an obstacle. So getting rid of Friesen, I think, makes this government more Heather Stephenson's government than ever before.
And, the one thing I think that didn't get a lot of attention, but I think is important to note, and is in the midst of all these changes, this is the first time in Manitoba history that the leadership of the government is all women. We've got Premier Heather Stephenson. We've got the Lieutenant Governor, Anita Neville. The clerk of the Executive Council is Catherine Girard. I think that's notable. I think it's also, I think, an important thing that Heather Stephenson, if you were to gain some kind of foothold and gain some kind of traction, is that Heather Stephenson has been able to shepherd in lots of different ways, and kind of a certain type of old male guard into a different relationship within a historically very male old guard party of the Progressive Conservatives. And I think that that's notable. I think that that's important for Stephenson to play out, particularly when I think in many ways the NDP in Manitoba is seen as more progressive than the Progressive Conservatives in so many other areas, particularly in Indigenous relations, particularly in, social justice, and the areas of, in the areas of healthcare, which we talked about a little bit earlier. And so, I think this is all plays for an interesting election coming forward. And of course, at the same time, we can't forget about the Liberals. And the Liberals this week have been, hitting the pavement and trying to rally and get people. They're certainly calling people, everybody that they can, to be able to get notable candidates for this upcoming provincial election. And on that note, I want to say a big thanks to Dr. John Gerard for recognizing, giving me a Queen's Jubilee medal just recently, and just very kind time that I spent with the Liberal caucus recently, just visiting with them. And I'm certainly no Liberal, but I can tell you that there's I think the Liberal Party is really gearing up for, as I heard and I spent time with them, they're looking at making some inroads in some major key areas within the province for maybe the first time since Sharon Carstairs.
Yeah, I'm not sure when the appropriate time to do it is, because although the election has to be held by October by law, it's the Premier's prerogative to drop the writ, as we like to say, the election writ at any time before then. And there will always be an opportunity to do that, but we will, in the age of pervasive, ubiquitous sports betting. Please stay tuned for a future episode of Niigaan and the Lone Ranger, where we handicap the 2023 Manitoba election, and I'll be accepting live bets, in-game bets on election night.
I don't know where we'll be on election night, but we'll definitely do some sort of call or prediction beforehand, and then hey, we'll just do a live 17 hours straight coverage. What do you say? Let's do it.
Yeah, well, that like the kids these days, they love to watch athletes and gamers watching athletes and gamers. So, everybody will remember, like,
I don't think anyone's going to love watching you and I.
No, but Alphonso Davies
riding by riding.
Yeah, he couldn't play in the last few games when Canada was calling for the World Cup. So he hosted a webcast where he was at home watching, the national team try to qualify for the World Cup. And that was like, people were watching him watching the game. So I think that people watching us, watching the election result, I think that's a winner.
That's a money maker. That's screaming money. You know what? Let's call Paul Simin, our editor, and I'm sure he'll be all over that. We can sell advertising. Speaking of Paul, huge thanks to the Free Press as always for supporting the podcast. We haven't we weren't steady because of my family situation last week, but big thanks to everybody for really emailing and asking what happened, where did we go. And so big thanks to everybody over there, and of course all the great people that are the Free Press, all of our colleagues, all the great people at CJNU, of course our producer Adam, all the great work that he does, and huge thanks to the mysterious storyteller that just showed up out of the blue. It took us weeks to book that guy.
Yeah, he was a real pain in the ass, but I'm glad we finally got that story told. So.
And also thanks to our feature interview.
Yeah, Angela Mathieson was great, and fortunately for Winnipeggers, she'll continue to do work as a planner and developer, and a trusted source of advice to people looking to make downtown a better place.
And so with that, we bring another episode to Niigaan and the Lone Ranger, off into the sunset yet again. And
I'm gonna get my coconuts to do the clip clop, a la Monty Python.
I think that's the wrong reference, but hey, I'll take them all at this point. Okay. So Niigaan, thanks very much, everybody.
Thank you.